In 2009, Brooks was in crisis. The health center in this community of 13,000 residents had just lost its obstetric services because of a serious shortage of qualified physicians. Expecting mothers had to drive over an hour to Medicine Hat, 2 hours to Calgary.
Definitely not everybody is going to make it that distance to deliver, and it was a real hardship on families.
Even the mayor of Brooks was personally affected. His daughter was attending university in Calgary at the time and wasn't sure she wanted to come back.
And when they were looking for communities to live in, when they were applying for jobs, one of the issues that came up while she was in school was, I got to have a place where I have access to health care, and I want to start a family. And
the loss of obstetrics became a motivation. The Joint Services Committee decided they needed to be more proactive in the recruitment of physicians. The members of this committee, the City of Brooks, the County of Newell, the Town of Bassano, and the villages of Dutchess and Rosemary, realized that they needed to become more involved in recruiting physicians, to work together with the doctors that were here, and to do a better job of showcasing their community to new prospects.
And we understand that we can't all survive alone, that we're stronger together.
so we started doing physician tours. We started to update our lists of programming. We started to bring in the incentives for housing and started to have the tours, set up things at banks and do all those things that RhPAP was really good at helping the communities establish.
They actually helped us in a recruitment process, making Brooks look more attractive. Small things like saying when a physician arrives in town, have somebody from City Council say, hey, this is Brooks. Can we show you around?
You know, we do those tours when the doctors come here, and we do a lot of work with that before we understand whether they're married or not, what they like in recreation if we can find out, whether they have kids, are they in school, are they not in school, and we show them the things that, the opportunities that are going to be in our community for them.
Hi, how are you?
In time, their efforts were successful. Brooks has grown from 9 family physicians to a full complement of 15. Dr. Eric Vanderlyn from South Africa was one of those who answered the call.
Probably the best decision I've made in my life is coming to Canada and coming specifically to Brooks and this community.
I was so surprised by how welcoming all the Canadians were.
First come here, you think it's probably just a stepping stone, and before you know it, you're here for 10 years and enjoying it.
In the past, the town of Bassano, 40 minutes west of Brooks, also had a shortage of physicians. That's now changed.
Oh, the medical services here are, in my opinion, they're second to none. Now we have 3 doctors working out of this facility, and one is part-time and the other 2 are full-time, and they're all just doing an exceptional job.
Obstetric services are back up and running in Brooks. 4 physicians have surgical capacity to do emergency C-section, and 4 are trained to do GP anesthetic services.
It definitely has moved quite a bit, hey?
Yeah.
So we actually have 2 physicians on for obstetrics every day now, one that does low risk and one that does high risk. And we now feel that it's a safer environment for patients and physicians because patients get a physician that's well rested, that is dedicated to obstetrical service, and if that physician runs into trouble, there's always a secondary physician that helps cover that.
Frank is a resident, R1 resident working here with...
The health center is also a training hospital for R1, R2, and R3 resident physicians, as well as nursing students from Medicine Hat College. RhPAP Skills Days have been held in both Bassano and Brooks, introducing post-secondary healthcare students from Calgary to rural healthcare. Even the 4 medical clinics in Brooks have embraced a collaborative approach. In the past, each clinic hired individually. Now, they formed a recruitment committee comprised of 1 physician from each clinic.
We're currently in the process of reviewing the replacement of a physician here in town, and we've had more than 50 applicants.
With obstetric services back in place, Mayor Barry Morishita's daughter and son-in-law did come back to Brooks to start their professional careers.
We got it back, and my daughter and my son-in-law are here, and my granddaughter is here. So, you know, it's a personal account, but that's exactly what it is. The community needs those type of programming to make it attractive for all the professionals, for any job seekers, for people who are establishing industry here. Healthcare and access to it is very, very important.
The powers that be realized the value of not only actively recruiting, and I think Brooks has been very effective in recruiting through, I think great leadership and vision, but also have noticed the value of retention.
With that in mind, the Joint Services Committee thanks physicians for the work they do in the community on a regular basis with gift baskets, flower bouquets.
Treat them well, and they'll want to stay.
Annually, we invite the doctors to just a round table discussion. We have some dinner, and we talk about issues.
Moving forward, the strategies that work for physicians will be used to attract and retain other healthcare professions. For now, though, time to take a moment to reflect on their accomplishments.
It means a great deal that other parts of the province are starting to see what we do down here.
Everything that we do well in our Newell region is another reason to attract and retain these people.
They stepped up and they said, we need to take care of our doctors so that they can take care of us. And it makes you feel appreciated.
While very proud of all the effort that goes into it, from the staff that are involved to the community leaders outside of the city of Brooks, to the people in the healthcare system that care so much about making sure we have people in the right places, to RhPAP, who's so invested in the rural healthcare model, how to improve it and how to make it better.